Thanks for joining us for this week's Health News You Can Use. I'm Lindsay Stish. Doctors across the country are seeing a rising trend of colorectal cancer in younger adults, as well as cancer-related deaths. However, colorectal cancer is preventable with regular screenings. I'm here today with Dr. Ludmila Schaefer, Director of Gastrointestinal Medical Oncology at St. Luke's Cancer Institute. Thank you so much for joining us today.
Thank you, Lindsay, for having me.
According to the National Cancer Institute, colorectal cancer is the #1 leading cause of cancer deaths for men under the age of 50 and #3 for women. New cases of colorectal cancer in adults under 55 have increased almost 2% every year since the mid-1990s, and death rates in this age group are also rising, even though colonoscopies are becoming more common. Dr. Schaefer, are doctors seeing an increase in colorectal cancer in younger patients here locally? And if so, why?
Yes, Lindsay. In our community, we also see increase in colorectal cancer in young adults. It's very interesting that in the past, we used to see patients coming in my clinic 60, 70 years old, 80 years old with colorectal cancer. And all of a sudden, for the last 5 to 10 years, all these young adults start coming with colorectal cancer. And we don't really know why, but it's under investigation. It's important to know that in colorectal cancer, it divided in colon cancer by 2030 could be double, and rectal cancer could quadruple in this patient population.
Now, what are some symptoms that people should consider seeing a doctor about?
There are a number of symptoms that people should see doctor about. Number one, when we see young person, a lot of times the symptoms sort of vague and not very significant. It might be some stomach upset or gas or bowel changes, and people think, well, it's hemorrhoids or irritable bowel syndrome or stomach upset. And a lot of times, especially young adult would say, that's not me. However, any changes within pretty much a week in bowel movement, different from your usual state, decrease in stamina and exercise, different from your baseline, abdominal cramping, unintentional weight loss without any specific diet, those blood in the stool, those symptoms are very, very important to pay attention early.
So why is early detection so important?
The early detection for colorectal cancer, Lindsay, is so important because it's research proven. One, if we diagnose early, the treatment for colorectal cancer would have less morbidity. Also, the earlier diagnosis, the better the prognosis. It's proven by research that treatment with colon cancer not only improves survival, people live longer, and it decreases death.
And what risk factors increase the risk of colorectal cancer?
So overall, there are several risk factors. Most important, we should know our family history. Talk to your family members. And if we discuss about family history, then we would know that someone should be screened a little bit earlier. However, there are only about 20% colorectal cancer would have any positive family history. So vast majority of population have really some risk factors that we don't really know if they predispose. Risk factors such as intake alcohol, tobacco use, increased body weight. It's known that taking a certain food and diet. And the main risk factors, it's unknown. We do know that microbiome, the bacteria in the gut, also changed probably for the last 5 to 10 years overall in the population. So maybe some lifestyle and diet adjustment that also could be as a risk factor.
Okay, that's good to know. Well, when should people start screenings for colorectal cancer?
Lindsay, the people should start screening for colorectal cancer earlier than we used to do. The American Cancer Society updated guidelines and recommended to decrease age for screening colonoscopy for 50. Now it's screening recommended at age 45. Now, just because someone younger than 45 years old, it's not a cutoff age. We see a lot of patients with colorectal cancer in 20th, 30th, and as of right now, number one, for average population, for average risk factors, recommendation screening at 45 years old. But also, if someone has a positive family history, then the screening for colon cancer recommended 10 years younger than your first-degree family member. There are very specific guidelines, so it's very important for everyone. Communicate with your doctor so then the appropriate age for colon cancer will be determined.
Thank you. Now, is there anything else you'd like to add?
Yes, Lindsay. So we would like to address that there are a few things. Please educate yourself and pay attention at your body health. Also, know your risk factors and communicate with your doctor and be advocate of your own body health.
Well, thank you again, Dr. Schaefer, for joining us.
Thank you very much, Lindsay, for having me.
If you'd like to find out more about colorectal cancer, including how to make an appointment for a screening, go to stlukeskc.org/colon-cancer. You can also stay up to date with all of the latest developments on the COVID pandemic and other health news from St. Luke's at stlukeskc.org/news. Thanks again for watching. We'll see you next time on Health News You Can Use.